In 2003, the Institute of Medicine released a statement about addressing healthcare disparities. And ASH then began the Minority Recruitment Initiative, which had basically short-term and long-term goals. And our short-term success would be determined by graduation attrition rates of our awardees compared to national estimates. And our long-term success rate would be determination of the retention into the field of hematology or related fields to national estimates of individuals from underrepresented backgrounds into the field of hematology. And so we were interested first in starting out with a medical student program, and also a junior faculty program. And those were the two initial award programs that we designed. And then we increased the number of programs from 2 to 6 so that we could provide additional opportunities for medical students to do more than a one-time rotation in research. We also designed the program so that medical residents would be able to have an opportunity to do research. And this could be done over a 1-year period, since we know residents are very busy. And we also designed a fellowship program, as well as programs for graduate students and postdocs. And so we looked at the national averages of individuals from underrepresented backgrounds initially, and determined that despite the fact that the number of, or the percent of the US population is almost 19% Hispanic, there were very few numbers of Hispanic physicians in North America, I should say, and also very few Black or African American physicians or scientists in the field of hematology. And so that was the baseline level that we started at. And we created then, with these 6 different programs, a 13-year pathway for individuals to be able to be supported from the start of medical school or graduate school to the end of their training. And for medical students, that also included end of fellowship junior faculty program. We also created positions for individuals who are awardees to have a career advisor as well as a research advisor. So they actually had 2 mentors, one who advised them on their research project, and all of these awardees had research projects, and one who would advise them in their career. And so the awardees were all expected also to write an abstract on their data and or present at the national annual meeting. And so when we looked at the data, and again, this has been something that we designed 20 years ago, and of course it takes time for individuals to graduate and move on in a program to be able to look at retention, but we were able to look at both graduation and retention of early trainees. And we could show that graduate awardees, or individuals who are graduate students, there was a 0% attrition rate compared to a national attrition rate of 36%. And then when we looked at our MMSAP awardees, the attrition rate was 2.2% compared to a national rate of 5.6%. And when we looked at awardees who remained in hematology, oncology, it was 14.4%, and 88% of the individual awardees were women. And women in medicine have also been sort of neglected in terms of being able to move ahead in their career. So even though they may start out close to 50%, we know that the numbers drastically fall off in terms of those that go on to become assistant, associate, and full professors of medicine. So we wanted also for our program to help develop individuals to be leaders in the field. I think it's become increasingly apparent, and there is published data, that individual patients feel more comfortable with individuals that look like them and speak like them. And so obviously language is important for patients to be able to understand their physician. And there are individuals who we all have implicit biases, but some individuals have implicit biases that are significantly great in terms of their understanding and interest in interacting with people of different races and ethnicities and taking care of them as patients. And so this is, I think, something that's very important. Our organization or our society has been a leader in the field of minority representation. And we've continued the program after 20 years. We've renamed it the Hematology Inclusion Pathway, which I think better aligns with our understanding and others' understanding of what we want to accomplish. And so this pathway is still very similar. It's open to everyone, and individuals interested in this particular pathway need to write a holistic evaluation of themselves, pointing out any difficulties or disadvantages they may have had. And so I think our program has shown that it is successful in terms of recruiting individuals into the field. Our early results suggest that we're retaining individuals in the field itself, which is very important. And actually, a third of those individuals that have finished in the pathway have gone on, and who had more than one award through our pathway, have gone on to get additional awards. So I think those are good indicators of how our program is doing. And I think this is really important as we see how race and ethnicity has affected not just our country, but the world over. And we all, we need to understand each other, and our role as physicians is to provide the best care possible to patients. And so we feel like this program is helping us provide the best possible care to patients. The American Society of Hematology is a convener of organizations and people. And so we are always looking for people to collaborate with. And I think the continuation of this program is very important because we know that individuals with sickle cell disease have been long neglected. And we also know that there are Hispanic patients who have a higher incidence of a certain type of leukemia, and getting them into a remission and then possibly a transplant can be difficult. So we're, facing problems as we look toward the future, and funding is going to be extremely important to be able to continue to do research. So it's not just our organization, but the National Institutes of Health, as well as other funding agencies that are national agencies, international agencies, are going to be very important in helping support research.